Hello, everyone. Sorry for the great delay. I'm your host today, Ying, and we were just having some technical issue, and hopefully it's now been fixed. So bear with me, and let me just try to start the meeting by sharing my screen. Right. A very warm welcome to all of you who have joined us on this nice Sunday afternoon. I'm Xiang Ying, your host for today's event. I'm excited to introduce our second talk in this online rehab health talk series on mobility issues in elderly. So for those who are new to this online talk series, it is a collaboration between the Malaysia Network of Caring Communities and the ReGen Rehabilitation Hospital. This is part of ReGen Rehab Hospital's corporate social responsibility initiative, aiming to help the communities in gaining back their functions. So 2 weeks ago, we already had Prof. Dr. Lydia spoken to us about the issues around rehab for bedridden elderly in our first episode. And this is now available on our MNCC website for viewing in recorded and ebook version. And as you can see, there are other important topics surrounding the care of our elderly that's coming up in the coming months. So today's program will consist of a 5 minutes introduction and then a 40 minutes talk, then followed by question and answer session. And we actually have a lot of double bonus act in our talk today. Our speaker today will be joined by his colleague during the talk for some live demonstration. And the talk will be conducted in a mixture of English and Malay language. So feel free to ask your question in any language. And later on, I'll also be joined by my co-host, Dr. Melissa Chung, during the Q&A session. So during the meeting, please keep your microphone muted at all times. Keep your video and camera off to ensure a more stable internet connection. And this session will be recorded. Your participation in this meeting implies that you're giving us the consent for the recording. Please type in your questions in the chat box on Zoom or on Facebook Live comment box. Alternatively, please use the raise hand button under the reaction tab. And then when being queued by the host to unmute yourself to ask the question, then you can ask the question directly to our speaker today. So here, I would like to make a disclaimer. So all the MNCC health talks aim to raise public awareness and promote healthy living. Information provided today is not to replace a doctor's consultation. So if you've encountered any personal health problems, please do not disclose it here to protect your confidentiality, but to consult your own personal doctor. So now let's introduce our speaker for this afternoon, Mr. Muhammad Amin. So Mr. Muhammad Amin was graduated from Anglia Ruskin University in UK. He also obtained his bachelor in physiotherapy from Masa University. He has over 10 years of clinical experience in both government and private hospital setting in Malaysia. His experience includes providing physiotherapy to our geriatric patient in neurology, cardiac rehab, musculoskeletal, and sports injury. And during his time off, I believe he enjoys traveling. So without further ado, let us welcome Mr. Amin.
Hello. Hi, good afternoon, everyone. Thank you, Xiang Ying, for introducing my name just now, myself. Okay, I'm Amin. You can call me Amin. Okay, so just now Xiang has already introduced some of me. Okay, so basically I'm a physiotherapist that worked already for 10 years at government hospitals and private hospital settings. And I deal and handling a lot of elderly patients, okay, which we call geriatrics. Okay, so many other patients as well, more to neurology cases, cardiorespiratory, any cardiac rehabilitation that related to geriatric. Okay, so today I would like to talk about my topic is about mobility issue in elderly. Okay,
Mr.
then,
Amin, would
yeah.
you like us to help you to share your slide, or you're okay from your side?
Okay, you can just share it for me.
Okay, yeah, if you just bear with us.
Sure. Okay, I hope everyone can see my slide here.
Yep, we can see it.
Okay, all right. So if there's anyone any trouble, so maybe you can just message in the chat box. So maybe somebody can try to adjust such a way. All right. So my topic today is mobility issues in elderly. Okay, so before we go on for the next slide, okay, so any one of you know what is mobility? Any idea what is mobility? So maybe anyone can chat in the chat box there and tell me what do you understand about mobility? Okay, someone has replied me ability to move. Okay, that's good. Okay, anyone else? Ada sesiapa lagi? Okay, that's good. Flexibility. Okay, very nice answer also. Okay, that's good. Balance, yeah, definitely. Seems like everyone here knows exactly what is mobility. Okay, Zangi, can you move on to the next slide, Zangi? Okay, thank you very much for perception. Yeah, that's good. Okay, so mobility is, as we call in Malay, we call pergerakan. Okay, so mobility is very important. Okay, so this is a very brief and short definition of mobility, the quality or state of being mobile or movable. Okay, so and the next one, mobility is the ability to move your entire body freely and normally. Okay, so mobility is very important. So all human beings and living things, so all need to move. Okay, so pergerakan sangat penting untuk kita semua, okay, sebagai manusia untuk kehidupan seharian. Okay, so without movement, so impossible for anyone to do the jobs, okay, the living life. Okay, so it's very important to move. Okay, so can we go for the next one? Okay, so how the body moves. So macam mana, bagaimana kita punya badan bergerak. Okay, so macam mana badan kita bergerak. So someone, if you see a human, so ourselves, okay, let's take a picture of ourselves. So how we move actually. Okay, so how our hand move, okay, how our legs move, okay, macam mana kita punya tangan bergerak, kaki bergerak, okay, dan juga macam mana kepala kita juga bergerak, okay. So it requires many aspects, okay, not only one aspect. Okay, so these are the aspects that is really important, okay, untuk buatkan kita bergerak. Okay, so salah satu aspek ialah central nervous system, muscle, bones, and joints. Okay, so central nervous system is our brain and spinal cord. Okay, so this all control our body to move. Okay, so for example, visual, auditory, and tactile. Okay, so it means like penglihatan. Okay, our vision. Okay, auditory adalah kita punya pendengaran. Okay, our hearing, and juga tactile is our touch, any sensation. Okay, so even though it is just visual, auditory, and tactile, okay, walaupun ini hanyalah penglihatan, pendengaran, dan juga sentuhan, tetapi ia sangat bermakna. It is very important for us to move properly. Okay, so because once we move, we want to move it properly. We don't want to move incoordinate, or we don't want to move imbalance. Okay, so how to get the proper movement? Okay, so these are the structures that really important. Okay, the muscles, bones, and joints. So without muscle, bones, and joints, it is very difficult. It is um, very not very difficult for us to move, okay, without the muscle, bones, and joints. Okay, so what are the muscle actually? So muscle is a pool of the joints allowing us to move. The movement your muscle make are coordinated and controlled by the brain and nervous system. Okay, so muscle is very important actually for us to move. So it pulls our joints. So muscle we attach together dengan kita punya joint. Okay, so what is our joint? Later I will talk about. Okay, so muscle it attached to our joints to move. All right, so if there's no muscle, there's no such way we can move. Okay, so it's really important to have muscles. Okay, is there any living things that don't have muscle? No, right? So every living thing, even though human being or even animals, we do have muscles. Okay, without muscles, there's no such a way for us to move. Okay, so and with the muscle, okay, it have to make sure that we move coordinately in a balanced way. Okay, so how to get this coordinated movement and also balanced movement together with the muscles. Okay, so I will show you later. So this means like I will show you the exercises, what really important to make sure that our muscle is really stay there. All right. Okay, the next one is bones. Okay, so what is bones? Tulang. Okay, so tulang is bones is provide support for our bodies and help form our shape. Although they are very light, bones are strong enough to support our entire weight. Okay, so bones attached together with the muscles, okay, and together with the joints. Okay, so bones is our frame. Okay, like you had a frame picture, right? So without a frame, you cannot hang the pictures itself. Okay, and also maybe like you want to build a house. Okay, you must have the proper frame. Okay, so you must get the proper frame to build a house. So without a proper frame, okay, without bentuk frame yang sesuai, okay, so we cannot build a house that we dream of. Okay, so with a proper frame, with a good frame, we can build anything. So it is very important, okay, for the bones to shape our body. Okay, so if you can see that the human orang dekat luar kan, you see the people like having short height people or having high height people. Okay, so these are different frames. Okay, there's some people that having broad shoulder, okay, buff hip, okay, pinggang lebar. So every human being we have different frame bone structure. Okay, so and every structure is giving us benefits to our own self. Okay, so you cannot, so there's certain people you see different than yourself, so so it have a really important useful for them. Okay, so every person having a different frame, okay, of bones, okay, for their individual functions. Okay, as a human being, we're having the same functions. Okay, so and having bones, so and proper frames to make sure that our body works good. All right. Okay, the next one is joints. So what is joints? Anyone can tell me what is joints? Maybe can check in the chat box there. Tell me anything about joints, or we call it sendi. Yes, so someone has replied sendi. Okay, so do you guys understand what is sendi actually? Okay, there's one. There's a mobile part. Okay, so sendi. Yes, correct. So where the movement occurred. All right. Okay, so here the definition of the joints. All right, so where two bones meet. Okay, so bones, for example, let's see, because we can say like my upper body, right? So I can just make you clear. So for example, like this is our arm. Okay, and this is our forearm. All right, this is forearm, and this is our arm. So where is the joint for these two? So these are the joint, the elbow, siku. Okay, so siku is our sendi. So it's a joining of two bones. All right, the one bone here, and also the next bone is over here to make a joint, sendi. So every moving parts in our body, it's sendi actually, our neck. Okay, how our neck move. So it has sendi, it has joints. Anything can move is a joint. All right, our ankle. Okay, how our ankle move. Our knee, we can bend our knee. Okay, we can straighten our knee. Okay, we can move our hip. All right, even we can hunch down. Okay, kita boleh bongkok, kita boleh berdiri tegak. So this is all joints. Okay, so without joints, there's no such a way we can move. Okay, or if can you guys imagine if let's say we don't have joints, meaning that we cannot, we don't have any joint movement. So our body can be exactly like the bamboo plant, right? Very stick there and very hard there. So there is a person, there is a condition of a case that where our body cannot move like that. Okay, so we can prevent it. Okay, to such a way to prevent our body become very stiffness. Okay, so this is what happens with as we become ages. Okay, become as we call become elderly. Okay, so our body can be very stiff. Okay, so why it is very stiff? Okay, so because the joints cannot move freely. Okay, but if you can see, if you can compare yourself, because I've been dealing with patients. I've been dealing with patients many stages of age. So there is 50 years and above, there is 60 years and above. Okay, so there is 70 and even 90 years and above. I've been dealing patient of that. I see the 90 years above of age, they can move very good compared to the one that is 60 years and above. So actually I can consider there's no such a reason way that we become aging, we cannot move anymore. You feel tired or you feel very difficult to breathe maybe, okay, you do anything such a chores at home, okay, you cleaning dishes, so maybe like you go for gardening and that time before you were old time, you were young time. So when you're old time at 60 years and above, you don't want to do such a because you feel that, oh, I'm become aging, so I don't want to do that thing anymore. So it's not true actually. So you have to keep doing movement, okay? And even though when you are at 90 years old, okay, so kita still masih boleh bergerak dengan betul kalau kita jaga. Okay, so macam mana nak jaga? Later I will show how to jaga our body, our joints, our muscles, our bones, okay, to preserve them. Okay, so to make sure that we can still move better, we still move good, even though we are after 50 years of age. Okay. Okay, so this is our joints, all right? So joints, they make the skeleton flexible, but without them, movement won't be impossible. Okay, Jen, can go for the next one. Next slides, please. Okay, so this is bad mobility. Okay, so when we age, okay, so yes, that is true for a person or for a group of people. If you guys are 60 years and above, or you guys are 70, okay, you feel different. Okay, like myself, I'm still young. Okay, so I want to make sure that I can still move good even though I'm getting age. So I must do all these things to make sure of that. So I will share with you guys how to make sure that even though if you guys are already 60 years and above, okay, you still can prevent yourself from getting worse. And in fact, you can even make your movement or your life become better. Okay, all right. So what is bad mobility? Okay, so as you can see from the slides here, so bad mobility is if you can't move efficiently or utilize the full functionality of your muscles and joints. Okay, so meaning that you cannot utilize, you cannot easily use your muscles and joints properly because you have joint pain. Or maybe you have muscle weakness. You feel like your body feel heavy and your body feel very tired easily, okay? Because of those important structures that I have taught you guys, I have shared you guys earlier, which our bones, our muscles, our joints, all right? So these main components, they become deteriorating. They become just semakin merudum, okay? Dia semakin merudum, okay? So this is what we call bad mobility. You cannot do your activity daily livings properly. You found that it's different when you do activity daily livings when you compared to the one that when you are at younger time. All right. Okay. So the next one is, it is not only mean a higher injury risk, but it is also means lower and inefficient performance levels during physical activity. Okay. So some people understand that, oh, I cannot move anymore because I'm having disease. Okay, for example, let's take example of a person who having a cardiac problem. Okay, ada masalah dengan jantung kan. Okay, so because of the cardiac problem, so they cannot do the things properly. They cannot do the housework properly. So they make it as a reason that, oh, because I'm having cardiac problem, so I cannot do like that properly. So it's not such a way. Any disease you guys have, joint pain, any heart problem, any kidney problem, okay, so that is not the reason you guys cannot move. Okay, we still can move. We just need to make sure that how to make it better. Okay, so whoever having any disease, okay, having any condition, all right, please don't please don't be so down. Okay, because it's not like if you have any disease, we cannot move anymore, we cannot travel, you cannot go outside the house anymore, we cannot go to the park, go any group therapies. We still can do that even though we are any one of you having conditions. All right, it's not limitation for you guys not to move. Okay. All right, so next one is, it can affect daily activities such as walking, cleaning, driving, and even showering if it is serious enough. Here, bad mobility issue. Okay, all the activity, the basic activity, daily livings, they will feel it disturbed to do. Okay, they will feel it's really difficult for them to do like walking. Suddenly they feel like it's really hard to walk properly. For example, like you want to take your shower, okay, it's really difficult to take your shower properly. You cannot handling the soap, or maybe like you guys, any one of you like using the soap bar. Okay, it's difficult you guys to get the soap bar all over your body. So because of the bad mobility. Okay, let's go on for the next one. Okay, so what are the causes of bad mobility? Okay, so as you guys can see here, one of the causes is muscle imbalance. Okay, muscle weakness, tightness, I mean by muscle tightness, okay, improper alignment and posture. And the next one is an injury that is currently in rehabilitation or was not fully or properly rehabilitated. All right, so all of this reason is from the main point that just now I have discussed with you, the main structures, the muscle, the joints, the bones. Okay, so all of these main points. So we need to take care of them. Okay, so muscle imbalances means that it correlates with muscle weakness. Dia sama dengan muscle weakness. So for those yang ada muscle weakness, otot yang lemah, okay, bila once otot kita lemah, so kita punya otot akan jadi tak seimbang. Okay, muscle imbalance. Okay, so that's why. So what I mean by muscle imbalance is when you walk at the park, or maybe you go to the shopping mall, right? You want to buy something at the supermarket. Suddenly you feel yourself like imbalanced. So maybe like you want to take any groceries from the supermarket, you feel yourself that you cannot, there's the difference of right hand and also the left hand. There's a difference of, you feel like something imbalanced, right? So that is called muscle imbalance, okay? And the next one, muscle weakness. You guys understand what muscle weakness. Tightness is the muscle tightness, okay? Otot yang ketat lah, all right? And improper alignment, okay? Posture is very important, okay? Even though I have treated many patients of 90 years and above, still having a good posture compared to the one that is 20 years of age. So we have to take care of posture. Okay, so I will show you how to take care of posture later. Okay, because this is the fundamental of having a good aging life. All right. Okay. let's go for the next one. Okay, so mobility issues in elderly. Okay, now I constrict it to the main scope. Mobility issues in elderly. So mobility declines with increased age. Okay, so this is a true fact. All right. So mobility declines with increasing of age. Okay, our mobility will declines, and we feel the aging after the age of 35 years old. Okay, so that's why for those who are the young, I mean the young old, okay, considered 35 years old of age to 50, they found themselves become deteriorating. Their stamina, the endurance is not as good as before. Okay, so this is a normal happens, okay, for everyone. Okay, whoever they feel that your stamina or your muscle strength is not as before anymore, is because of age. As we aging, okay, our movement, our strength will be deteriorating, akan menjadi lemah. Okay, so difficult to do such a task, okay, a normal task at home or at the workplace, okay, because of as become age. Okay, so all right, the next one is the first sign of declining mobility are typical observed for more demanding mobility tasks such as walking, like I told you guys just now earlier, like running. You guys feel last time maybe you can just run 10 kilometers of distance, then suddenly after 10 years later, you guys cannot even run 2 kilometers. Yeah, what's the reason of it? Okay, so there is a reason. If you feel difference with your body, there must be something inside. So we have to check. Okay, it's not because of only age. Okay, so sometimes it can correlate with another things, okay, such any other disease or condition. All right, so that's why we must always do medical checkup. Okay, we have to check our body, like what the doctor advised, like every 6 months once. Okay, so to check our body whether it is a good condition or not. All right, so we have to do a proper checkup every year, okay, or every 6 months time. All right, okay. The next one, hearing and vision impairment correlated with increased fall, and that the risk of falls was particularly high among people who had multiple sensory impairment. Okay, so as we got age, as we at the stage of elderly, okay, so we will have some hearing and vision problems. So that is crucial. Okay, so that is normally happens to every one of us. Okay, so and because of this too, hearing and vision problem, it affect our balance. Okay, because all the importance of our things for our balance, it all coming from hearing and vision. Just imagine yourself, you guys close your eyes and you guys walk. Can you walk straight? Okay, or can you walk straight, or you bump to another wall whatsoever, or bump to a person? Okay, so you guys imagine without proper or without good hearing and good vision, how our movements. Okay, so it is really important to take care of our hearing and our vision. Okay, even though through aging, okay, our hearing and vision will disturb, but we can delay it. We can prevent it to become worsen. Okay, so for those who have problems such a way of hearing and vision impairments, okay, you can just we can prevent it from getting worsened. Okay, don't you worry if it is not recovered very properly, but we can prevent it from getting worsened, because as it gets worsened, so the limitation of the movement will be worse also. Okay, okay, let's go for the next one. Okay, so self-monitoring. So we have to self-monitoring ourselves every day. Every morning we wake up from bed, so we have to self-monitor ourselves. Okay, every day just do it. Okay, every once a week just monitor yourself. Every day we should monitor how's our back mobility. Okay, as we get up from the bed in the morning, in the early morning. All right, so how we do the back mobility from lying down position to get up, sit at the edge of the bed. So we have to monitor on that. Is there any changes, okay, compared to the last time? Okay, if there's any changes, so meaning that there's something happened to your body. How your ability to sit, to stand, okay, Last time you can just sit without holding on. Last time you can just sit with one leg maybe. Okay, I mean like to stand with one leg maybe. Or last time you can just sit to stand by talking to the phone, or maybe like sit to stand while carrying heavy objects with you. Okay, but now maybe you're having problem to stand, even though you need someone to hold on. You need to get something to hold on. Okay, so or you need to put the things that you hold, the heavy things you need to put on the floor, and you need to stand up. Okay, so you found that there is difference compared when you guys before. Okay, so you guys need to check how's your ability of standing, and also check how your ability of walking. Okay, and also if you feel any difference of you guys walking compared to the last time. Okay, so you guys need to check on that and check our functional activities. Okay, kita kena check activity harian, functional activities. Okay, so seperti macam like housewife, they do the housework like washing the dishes. Okay, maybe like to do gardening. Okay, maybe like men, maybe like last time you have to suka bertukang dengan apa buat project kayu ke apa-apa ke. Okay, so but later on tiba-tiba ada rasa perubahan. Okay, disebabkan changes. Okay, so you guys have to monitor yourself about all of these things. So if all of these four you feel different, so maybe there's something problem with your muscles, joints, okay, or something happened with our bones. Okay, all right, let's go for the next one. Okay, so how ways to improve mobility problem. Okay, so luckily, fortunately, there is ways to improve. Okay, ways to improve it doesn't mean like it's totally recovered, you're totally cured. It's not like that. Okay, so ways to improve mean that you want to improve it in such a way from getting worsen. Okay, you want to improve it such a way stage by stage. Okay, but it takes time. Okay, so we have to bear with it. All right, so as we got age, there's no way that we can become like old time anymore. As there's no way we become like young time anymore. All right, so we have to face it. Okay, as we got age, we cannot become like how we are 20 years ago. All right, or at the age of 30, or at the age of maybe school time, we cannot become like that anymore. Okay, as we got age, okay, so we can just make it improve a little bit. Okay, you make it improve so that in improve such a way that you can buat aktiviti harian dengan lebih sempurna. Okay, walaupun tak baik ataupun tak bagus, tapi sedikit elok. Okay, so itu memberi banyak kesan yang sangat bagus. Okay, daripada ia menjadi lebih teruk. Okay, so then kita boleh prevent. So what are the things that is physical activity is very important. Okay, and peace of mind. Okay, so every one of each of us must have any stress or any having depression because of the condition that we may have. Even though like if we have a normal fever, also we feel like very tired, very depressed because you cannot do properly, right? So just compare to the person who having a serious problem. So we should have a peace of mind. Okay, healthy weight and healthy diet. Okay, diet is very important. Okay, tak boleh ambil makan yang tak berkhasiat. Okay, makan junk food saja, ataupun pagi-pagi breakfast makan goreng-goreng banyak sangat. Okay, ataupun suka makan nasi lemak, suka makan mie goreng, bihun goreng. Time muda-muda boleh makan. Tapi bila dah tua kita kena jaga. Even though we have to jaga at the age we start 30 years of age, kita dah start jaga makanan. Alright, so kita kena jaga diet. Okay, jaga diet bukan bermaksud, it's not meaning that you want to lose weight, or you want to jaga diet meaning like you don't want to become overweight. Jaga diet, healthy diet meaning that you eat properly. Okay, so you eat properly with proper nutrition. Okay, so then it will reflect. So we have to take care of within. Okay, then it will reflect outside. It will reflect. through physically. All right. Okay, and the next one, identify fall hazard at home, okay, and eliminate them. Okay, so as we got age, okay, so we have some balance problems, some muscle weakness, okay, so there is chances of fall. Okay, so avoid from falling, okay, especially for those who are at home yang ada banyak hazard, alright, macam banyak tangga, any steps, okay, any slope. So we have to identify that, because once seseorang individu tu jatuh, okay, so akan mengalami masalah yang lebih teruk. Okay, seperti patah tulang. So bila masa patah tulang, kena masuk hospital, kena buat operation. Dan even though lepas operation, ada complication after operation pula. So you guys have to start from square one, how to get the muscle back in action, everything all. So we have to avoid ourselves, okay. For elderly, you need to avoid your guys from fall, okay. So how to take care or how to prevent it, so you guys can use any walking aids. All right. Okay, there's many elderly patients I've been dealing with. They don't like to walk with walking aids. Dia macam action. Dia tak nak tunjuk dia tu nampak tua. Nak jalan seperti macam orang normal, seperti orang biasa. Okay, so dia tak nak guna walking aids. Okay, but throughout my experience dealing with this kind of people, but they end up to had a fall after that. So then they feel macam rasa menyesal lah kenapa dia tak guna proper walking aids. Okay, well, even though our muscle become deteriorating, kenapa tak guna. But you guys don't have to feel embarrassed if you use walking aids. It's not like that. It's just our preventive measure. Nak elakkan kita tak nak jatuh, actually. Bukan ni nak tunjuk kita dah semakin tua. Kita tak nak, bukan, using a walking aids is not like you are picture yourself or you show to people that you're getting semakin tua, bukan. Actually, it's a prevention from getting, from fall or any accident or any incident. Okay, even full accident. So we can prevent ourselves from falling. That's a normal main reason. Okay. Make sure proper footwear is very important. Okay, tak boleh kasut terlalu licin ataupun terlalu kesat dengan lantai. Okay, nanti boleh jatuh juga. Okay, and don't get help too much. If you get help too much, so meaning that you contribute yourself to getting muscleness later on. Okay, let's go for the next one. Okay, so these are the example of physical activity. We have breathing exercise. Okay, breathing exercise is very important. Okay, why it is very important? So it correlates to our performance, activity performance. So if your lung is not functioning very well, so macam mana kita nak lakukan aktiviti harian dengan sempurna, seperti yang banyak berjalan, okay, yang banyak menggunakan tenaga, okay. So kalau kita perasan ada tak sesiapa yang bila buat aktiviti rumah tiba-tiba cepat mengah, okay, ataupun berjalan sikit dia naik tangga sikit cepat mengah. Macam tu. Because bila kita semakin berusia, okay, kita punya lung capacity, kita punya lung elasticity tak cantik. Okay, so kita kena jaga kita punya lung juga, bukan hanya physical saja. Okay, bukan muscle, bukan joint, bukan tulang, tapi kita kena jaga kita punya paru-paru juga supaya dia boleh bekerjasama dengan aktiviti kita buat. Okay, so kita punya lung akan jadi kita panggil less recoil, dia tak macam elastic macam dulu. So kita kena kembangkan balik. Okay, so our lung is like muscle. It can become tight. Okay, so if you guys feel kalau you jalan sikit tiba semengah, meaning that your lung cannot cope that kind of activities. Okay, so meaning your lung expansion tu tak cantik. Alright, so kita kena improve your lung function in order to improve our activity daily living function. Okay, the next one is stretching exercise. Okay, senaman regangan. Okay, all the muscle we need to stretch. Muscle is like rubber band or any like band, any elastic band. So kalau kita tak lenturkan band tu, so dia akan jadi keras. Okay, dan dia akan senang patah. Right, okay, sama juga dengan muscle. So kalau muscle tu dah tak guna terlalu lama, kalau pernah nampak pesakit yang bedridden, duduk atas katil saja kan, tak gunakan otot tu dengan betul. So the muscle can become very tight, and lama-lama dia akan senang rupture. Okay, so kita kena jaga flexibility of our muscle by doing stretching. Just now when I asked you, any one of you yang jawab mobility is flexible, right? Okay, first flexible is definition of the muscle flexibility. So we need to do stretching, okay, to maintain our muscle flexibility. So kalau tak buat stretching, okay, proper stretching, so our muscle can become very hard. Okay, nanti dapatlah sakit tengkuk, right? So itu, okay, like compared to the sedentary lifestyle, okay, bila dah lama tak buat, for example like kalau you guys dah lama tak workout atau jogging kan, okay, tiba-tiba after 3 months later, tiba-tiba jogging balik. So apa you guys rasa? So you guys must feel like macam muscle soreness, very tight muscles over here, okay? So that is because the muscle become macam shock, dia terkejut. So you guys have to do stretching to flexible the muscle so that it can cope our movement, alright? The next one, strengthening exercise untuk kuatkan otot. And next one is endurance training, aerobic, okay? Alright. So strengthening is nak kuatkan otot, okay? So bila once our muscle flexibility is good, and then our muscle otot pun semakin kuat, dia maintain kuat, so kita punya joint pun akan bergerak dengan lebih sempurna, kita punya sendi, okay? So kita kena jaga flexibility muscle, kita kena jaga kekuatan muscle, alright, untuk dapatkan pergerakan. Next one is endurance training or aerobic. Sangat penting juga. Okay, kita hanya bukan buat senaman dengan senaman pernafasan, breathing exercise or stretching exercise, senaman regangan or strengthening exercise, senaman kekuatan otot. Tapi endurance or aerobic pun sangat penting. Okay, so apa kepentingan endurance training adalah untuk menjaga kesihatan jantung kita. So apakah example, contoh senaman aerobik seperti berjalan, brisk walk, okay, ataupun berlari kalau masih yang boleh berlari kan. So itu adalah contoh-contoh senaman untuk menjaga kesihatan jantung. So untuk mendapat flow healthy aging, cuba amalkan, okay, try to practice, okay, and try to do all these 4. Okay, then you guys can feel a lot of difference. You guys can prevent yourself from getting worsen. Okay, even in fact you can improve yourself to the better daily life. Okay, let's go for this one. Okay, human are meant to move. Definitely, betul tak? Anyone agree with me? I hope everyone agree with me, right? Okay, I hope I don't get any answer that to say that, no, I don't agree. Human are not meant to move. No, every human are meant to move. Muscle are meant to move, stretch and flexible. Okay, ini daripada Dr. Amin Lee. Dia kata everything gets worse when we age. Older gets better when we exercise. So the remedy is only do exercise. Okay, it's not only so how to. If you feel like you cannot move properly, okay, some people may thought that, is there any medication that can save my movement? Is there anything that I can eat or anything that I can drink that can recover my movement? It's not like that. It's just do exercise. Then you can recover your movement. Okay, just move. Some people, they feel like allergic with the term of exercise, right or not? They say, oh, I have to sweat a lot, I have to move a lot. No, exercise it means by movement. Okay, so just do any movement. It doesn't matter. Just move your joint, just move your shoulder, your muscle, your leg. Just move it. Okay. If you guys don't know the exercise that you do, so just look at the mirror and do what are the movement that you can do to your body. So that is considered exercise as well. Okay, so meaning you move, everything. Movement is exercise. Okay, just move. Okay, even though you walk around the house area, walk from the living room to the kitchen, it's actually exercise. So if you go to a hospital, doctor say you have to do exercise. If you go to physiotherapy, the physio say you have to do exercise. And the person exercise don't want to do lah. It's not like that. Exercise means by move. You have to move. Then only you feeling better. All right. Let's go for the next one. Okay, so these are the example of diaphragmatic breathing exercise. Okay, I believe I have short of time. All right. Okay, so diaphragmatic breathing exercise is this one. So we have to do, so we breathe through our diaphragm. Diaphragm is dekat awal ni perut. Okay, so this is the picture. Okay, you guys can see, right? Okay. Place a hand on your stomach, okay, and breathe in. You kena rasa you punya perut tu bergerak ke hadapan. Meaning that you are encourage the air until down to your stomach. So this is the diaphragmatic breathing exercise. So this breathing exercise is really important and really good to maintain our lung expansion, to maintain your oxygenation. Okay, for those who having any disease with lung, macam contohnya COVID, right? Okay, siapa yang ada pernah ada COVID sebelum ni, so or any lung condition, so do this breathing exercise, it will improve your oxygenation. Okay, because oxygenation runs within the lung. Okay, so maintain your lung expansion, you will prevent, you will improve yourself from getting panting, cepat penat sewaktu buat pergerakan dan juga buat senaman. Okay, so this is a diaphragmatic exercise. Take a deep breath through your nose and then breathe out to your mouth like that. Okay, let's go for the next one. Okay, so this is the visual of how our lung, okay, as we breathe in, inspiration is breathe in, our lung is longer. Nampak tak dia semakin besar? Breathe in, our lung longer. So this is how what I mean, our lung is like getah. Dia like macam very elastic, it can expand. So we want to stretch the lung also. It's not stretch the muscle, but we also want to stretch the lung. So as we breathe in, we stretch the lung. All right, so then you get more air. When you get more air, you get more oxygen. When you get more oxygen, you will prevent yourself from getting dizziness, macam pitam, tiba-tiba buat aktiviti, macam rasa nak pitam, rasa macam nak tiba blank kan, because you have insufficient of, one of the reason is you have insufficient of oxygenation when you do any activities at home or outside or any at your workplace. Ni kita punya yang sebelah ni pula is our frame lah of the bones, right? So when we breathe in, the rib cage also, tulang rusuk pun dia akan buka juga. Tulang rusuk pun akan buka juga. So kita kena maintain expansion of the lung. Okay, let's go for the next one. So as you lie down, you breathe in, see? Actually inside it's expand. All right. Take a deep breath and then you will expand your lung. Okay, so try to do this. Take a deep breath. Okay, and breathe out. Breathe in, then breathe out in lying down position. Okay, so you are encouraging your lung to expand, untuk kembangkan dia lagi. So dia untuk maintain dia punya lung elasticity, macam tu. Alright, so try to do it. Okay, so you may find that your breathing effort when you do any activities at home will be improving, getting better. Okay, let's go for the next one. Okay, so these are the, okay, now let's go for the stretching exercise. Okay, gambar model ni dia orang muda lah. Okay, so sesiapa yang berusia 70 ke atas tu mungkin tak boleh duduk dengan straight kan, walaupun mungkin tak boleh duduk dengan tegak dan buat sempurna macam dalam model ni. Okay, tapi saya just bagi gambaran example saja. Okay, so just sit down straight, just sit down as straight as you can. It's not like as straight as you can. It's not like you have to sit straight like this person in the picture, or maybe you have to sit straight as like your grandchildren sit straight on a chair. It's not like that. Even though you have any kyphotic problem, ada masalah posture dah semakin bongkok kan, okay, so just sit straight as you can and then try to move like this. Okay, just stretch your neck. Okay, one side hold here, and then just stretch it like this. All right, make sure the shoulder doesn't go up like that. If it is go up, meaning it's not effective. Just maintain your shoulder relaxed, okay? And you will feel the stretch alongside of this muscle, okay? And hold it hold it for a few seconds, 10 to 15 seconds, all right? And then relax. So this is how to prevent from having neck pain, okay? To prevent from getting any like pain over your shoulder muscles. So this exercise is very important, very good, and very effective, okay? To reduce any kind of neck pain, any kind of neck difficulties, limitation of neck movement is really important. So you guys can do it both sides lah, one on the right side, and also the other one is over the left side. Okay, but you need to hold. If you don't hold, it doesn't stretch. If you don't hold, you just do movement only. So if you hold, so meaning that you're stretching it. Okay, so try to hold it for 10 to 15 seconds. All right, so then the muscle will stretch. If you just hold like and just kira laju 1, 2, 3, 4, 5, 7, so it doesn't work actually. Okay, so if you do 100 times also, it doesn't work also. So you just need to stretch and then hold it for 10 or 50 seconds from the clock, okay? Not from your count. Your count will count faster. All right, okay, let's go for the next one. This is another type of muscle. Okay, just now the neck muscle. This is the trunk muscle. Okay, I know not everyone can achieve this shoulder movement higher like this, right? It doesn't matter as long maybe you can just put your hand down like this also. Just remind, you can just put it down like this also. Just move the trunk sideways. It helps also. Okay, so just move your trunk like this. Put your hand down. Okay, just move sideways. Also helps to stretch your trunk muscles. Okay, if you guys having difficulties to move like this and move like this, okay, doesn't matter. There is another way. So just put your hand down and just move your trunk laterally like that. I can see someone do. I can see someone do from the video there. Very good. Okay, you guys can achieve that movement. Okay, so that's very good. Okay, if you guys cannot bend your trunk like this lady do, doesn't matter. Just do as much as you can. You feel the pulling, you feel the stretch, dah cukup. Tak payah nak jadi macam orang muda ni lah. Okay, so as long you can stretch your body, dah cukup. Okay, let's go for the next one. Okay, the next one is pectoral stretch. Ni kita punya bahagian dada depan lah. Alright, so this is to prevent ourselves from getting kyphosis. What is kyphosis? Kyphosis is badan yang bongkok. Badan bongkok sini kan, macam bongkok. So how to prevent ourselves? How to stretch our body to become bongkok like this? So you can do stretching like that. Open your chest. If you cannot do like this, also just open your chest. Open your chest at the chair. That you helps to stretch your muscles at the front area. Okay. Okay, let's go for the next one. Okay, this is hamstring stretch. Okay, this one is don't have the video properly. Okay, so you just do your legs like this, and then you bend your trunk down. Then you will stretch your hamstring. Hamstring is where peha bahagian belakang. Ni peha bahagian belakang ni kan. This is our hamstring. So this one can be very tight also. And when this one very tight, difficult for you guys to walk properly. Okay, so you have to stretch this one. So then only that you found that your walking ability will be better. All right. So just do like this movement, and then you feel the stretch over here. Do one side. So meaning that there's one leg is straightened, right? So meaning you stretch this leg lah. Okay. And then when you done this one, and then you straighten the other side of the leg, so meaning you stretch the other side of the leg. Try to do this movement on a chair, in a dining table, or maybe you can do in a dining chair. Just do the movement. Right? Then you feel the stretch at the behind part of your thigh, meaning that is effective already. All right. Okay, let's go on for the next one. Trunk rotation. This one also impossible lah. You guys may ask lah, why I put all this picture of a young people like this, Okay, but if this is just to show you example of proper exercise lah. Okay, so if you guys cannot do like this kind of posture or position, okay, it doesn't matter. This how the lady does it. They cross sitting, and then they rotate the trunk. They rotate the trunk, so this one also stretch the trunk muscle. Okay, so this helps to prevent. This helps to reduce back backache. So for those having a back pain, having a low back pain, try to do this exercise. So it helps to reduce your back pain. Because the back pain sometimes, not sometimes, most of the back pain, the reason is because of muscle tightness or any muscle hardening at the low back. Not only for low back, the whole back. So do this movement, it helps to reduce the pain and you feel more flexible. Okay, remember when you do stretching, hold it for 10 to 15 seconds, all right? Okay, let's go on for the next one. Okay, just a second. Okay. So strengthening exercise, free weight exercise. Okay, so how about strengthening exercise? Just now I talk about stretching. This is strengthening exercise. Okay, so strengthening exercise is you move your shoulder. Okay, just move your shoulder anyways. All right, move your shoulder. Okay, like this. Up to the front. You guys can see me, right? Okay, to the front. Okay, and sideways. Okay, move your shoulders sideways, like this. All right, and then move your elbow, bend your elbow. Okay, and move your wrist. That's all it takes to maintain your muscle strength. All right, and also move your hip. Okay, how to move your hip? You can move your hip like this. You can hold the chair. Okay, for those who are having a fear of fall, right? So you can hold the chair and move like the hip like this. Okay, I supposed to have one volunteer, a model for me to do these exercises, but I believe that we have short of time, so I cannot show this exercise properly. Okay, so I just show like this, right? And you can move your hips
Mr.
sideways.
Amin, Mr. Amin,
yes.
Sorry to interrupt. I think the participants asking whether you can stand slightly further away from the screen so that they can see the exercise better.
Okay, can I? Okay, I can show the proper exercise. Let me just get a model for me. Okay, hang on.
Yeah, that's fine. That's fine. I think that the participants rather see things properly, so don't worry about the time.
Okay, so I have a volunteer to do the exercise. Okay, so the first one, the shoulder. You guys can see? All right, okay, body straight. Okay, and then move your shoulder forward like that. Body straight, move your shoulder. You guys can do in standing position and also in sitting position. Like that. Okay, do up to 5 times. Okay, so our shoulder can move forward, right? Okay, so move forward. The one that my model hold is a dumbbell. Okay, so if you guys have a dumbbell, okay, 1 kg or maybe half pound can do. Okay, next one is sideways. All right, like that. Okay, next one is elbow. Okay, bend your elbow. Okay, very good. Okay, so this is your upper extremity. Okay, next one is lower extremity. Okay, how to do the exercise for lower extremity? You can put the dumbbell. Then move your leg forward, bend forward. Can you guys can see? Move the leg forward, bend forward. You can hold the chair to prevent yourself from falling, okay? Like that. Okay, next one is sideways. Okay, like model here, my model here, he can move high. For those cannot move high, just move as high as you guys can, don't worry. As you guys can move, do this movement, that's really good already. Okay, then bend knee. Like that. Okay. Okay. Okay, thank you. All right, okay, next one, let's go on. Okay, aerobic endurance training to maintain our heart function. Okay, for our stamina, we can do seated marching. Okay, standing marching, sit to stand, walking, and brisk walk. Okay, I have a picture after that. Can go on to the next one. So this is the example lah for marching in place or marching on spot. Okay, so you guys can hold the chair. If you guys cannot do like this also, doesn't matter. Just hold the chair, something to hold on to prevent yourself from falling, and do this movement. Okay, go for the next one. This is partial squats. Cangkung sikit je, tak payah banyak sangat. This is good already. Okay, for those who having balance problem, you can hold on the bar, any grab bar. Okay, just hold on the grab bar and do this movement. Okay, or maybe hold on the chair and do this movement. Okay, go for the next one. So these are the example of aerobic exercise, walking. Okay, next one. Bicycle also is included as endurance exercise. Okay, so for those who cannot move around, okay, for those who feel like very tired or maybe like don't have the capacity of energy to move around, do exercise, you can just sit down. Sit down, do ankle pumping. Ankle pumping, it means that you move your ankle. For example, this is ankle, right? Just move up, down, move up, down. Just sit down like this picture I showed. This one is picture, right? Just do ankle pumping. Okay, do knee straightening. Straighten your knee. Okay, in sitting position. Hip bending in sitting position. Bend your hip up. Okay, and for your shoulder, move your shoulder forward. Move your shoulder sideways, and also shoulder touching. Just touch your shoulder like this lah for your elbow. For your elbow exercise, right? Like this. Okay, you can do all these things in sitting position. All right. Okay, let's go for the next one. Okay, so these are the benefits of exercise: improve our balance, joint flexibility, strengthen the bones. Okay, as we got ages, we're prone to get osteoporosis. Okay, meaning that our bone density become lower. If you do exercise, okay, do walking, endurance, aerobic strengthening exercises, you will reduce your osteoporosis to the worsen. In fact, you'll improve your bone density. Okay, this is how to improve and prevent our osteoporosis, right? Help to reduce body fat, okay? Help also reduce stress, tension, anxiety. You sit too long, okay? Sesiapa yang asyik suka duduk, tengok TV, kan? Actually, we are prone to get stress and tension and also anxiety. So just move around, okay? Then you feel better, okay? And boost self-image and self-esteem. Improve your sleep. You guys not doing, okay? For those yang dah pencin, dah retired kan? Duduk rehat kat rumah je kan? So that's why you guys having problem with sleeping. Because you guys not moving. You guys not do exercise. You guys not move. Compared to last time, you guys like macam very active, right? So why you guys having sleeping problem? Because not moving. Okay, so when you do exercises, you feel your sleep will be better. Okay, next one, you make you feel more relaxed and rested, make you look fit. Okay, next one. Ni example lah yang suka duduk kan, tengok TV, tidur. Ni posture yang sangat salah ni, boleh jadi lebih bongkok. Kerusi malas kita panggil ni kan, rocking chair is not good actually. It will make our posture to be kyphotic, menjadi lebih bongkok. Not good actually. Alright. Okay, let's go for the next one. So this is our normal spine. Our spine is our tulang belakang, dia bukan hanya straight saja, dia ada curve. Okay, dia curve macam ni dia curve. Alright, dia bukan macam bamboo spine, bamboo plant. Dia actually curves. Okay, so how to maintain your spinal curve? You have to take care of your posture. Okay, just sit straight, walk straight, try to stand straight as possible, then you will take care of your posture. If not, if you keep yourself slouched, if you keep yourself sitting only and in a rocking chair like just now the previous picture, you'll get yourself to be slouched and make your spine become more like C-shape lah. C-shape. This spine looks like S-shape, right? Okay, let's go for the next one. So these are the goals. Okay, you have do not continue exercise if you have pain. Okay, so if you guys have pain, you have to make sure that when you do exercise, you don't have pain. After that, if you guys have pain, meaning that don't continue, meaning that it's enough already lah for this exercise for you. Right, and such a way lah. Exercise tips, movement should be done in controlled manner to prevent injury. Don't do just silly movement or rush movement. Okay, tak boleh buat laju, kena buat just slowly. Okay, relax and just do the movement. Alright. Okay, let's go for the next one. So this is the place I work. So this is the end of the slides. So we have a lot of equipments here, all right? So a person, anyone want to come over here can come. I can check you guys. What's the problem? You guys don't know what's the issue. Okay, you guys having a muscle problem, muscle weakness, any balance problem. You guys don't know, right? Okay, so usually people will come over here. I will assess them fully. I will assess them fully, and then I will set the goals. So what are the improvement that the person can do? Okay, setting their goals, and then do the treatment such a way. Okay, do the exercise. For those yang don't have any clue how to do exercise, how to start, don't worry, can come over to the physiotherapy center here, like I work over here, right? Okay, so we can help you. Don't worry. So you guys may afraid that if you guys do movement or any movement, walking, if it is safe or not, you guys to do. You guys don't have any idea, anything, all right? So you can get a guide, okay, like myself or any physiotherapist over here. Okay, then we can show you, we can help you, and also that we can educate you so that you guys can do at home properly and in a safe manner. Okay, that's all.
Okay, thank you, Mr. Amin, for such an informative and useful talk. And we do receive some burning questions from our participants as well. So I think we can go through the question now. Is it okay?
Okay, yeah, sure, can.
Okay. So for the first question, one of our participants asked, what is endurance training?
Okay, endurance training, like I talked earlier, is to maintain our stamina. Okay, as like the example I give just now, when you walk, then you feel panting a lot, cepat mengah, rasa cepat letih, even though you guys walk for a short distance. So meaning our stamina is really getting lesser, getting poor. Okay, so what's endurance? So endurance is the exercise of correlates together with our heart, okay, our lungs, and also our muscle activity. So it required all of this, so they becomes endurance exercises to improve our stamina. Tak nak bagi cepat penat bila you guys berjalan ataupun buat aktiviti dekat rumah ataupun dekat luar.
Okay, thank you for the explanation. Now, okay. Yeah, I think it's quite clear. Yeah, okay. So we have the second question from another participant. So this is a male who is 78 years old and had early onset of Parkinson's disease. His right arm cannot grab things properly and shakes occasionally. Please advise specific exercise for him. Thank you.
Okay, so these are the normal symptoms for Parkinson. Okay, sometimes the Parkinson, they have the shaking, right? So we got tremors. Okay, sometimes the tremors happen when you're rest or when you're movement. When you're moving, then you have the tremors, the shakiness of the hands. Okay, so because of we have this kind of condition and situation, we feel we don't want to move anymore. Okay, so maybe of lacking of movement or lacking of activities because of this problem. Okay, your muscle become weakened. Okay, so have to do the exercise for the shoulder, elbow, like I just showed just now. Okay, that will improve the muscle strength, because even though we don't move our muscle properly for more than 2 hours, okay, and it will diminish, it will deteriorating slowly. Okay, so we have to do so. Just compare with the one that who didn't do any movement for more than 2 weeks, or maybe even 1 month, or maybe even 1 year. So the muscle really become very weak. So the tremors, the shakiness of the movement of the shoulder become really worsen. Okay, so just do strengthening exercises that it helps to reduce the shakiness of the movement, or maybe because I have patient also, the shakiness of the movement is just not come again. Okay, I hope it's clear also.
Yeah, I think it's a very clear explanation. Yeah. Okay. So I think if the participant, if you still have a question and if you think that the explanation is not clear, feel free to type in the chat box. Okay. So for now, we will move on to the third question. Can a 65-year-old gentleman still go to the gym and build some muscles?
Can, definitely. Why not? You're welcome to go. Okay, but you must get an instructor. Okay, so if you got age, okay, we must have a proper instructor, a knowledgeable one. Okay, so you are advised. Okay, just maybe you guys go to the gym, so have a instructor that who knows a 65-year-old person, okay, as a medically way, okay, because every elderly patients, every people, they're having different kind of conditions or disease, right? So you don't know. So for those instructor, or maybe like a person that guide you, don't know what is your real condition. Maybe you have a heart problem, or maybe you have some inside problem differently. So certain exercise cannot do. Okay, so you must have proper guidance to do exercise. But you guys can go to gym, but must have proper guidance. Someone has to know your real condition. Okay, not only by physically. Okay, they just check that, oh, they cannot move the shoulder, they cannot move the leg, so I want to give them 100 repetitions of movement. Cannot. They don't know that the real issue, the inside issue of the person, then it will collapse. So like myself, I'm a physiotherapist. Are well trained, okay, we are medically known, okay, what's the condition, what's the situation of the patient, we'll assess properly, thoroughly, and we will educate them, and we will give the exercise that really suitable for this certain patient, or this certain people, not patient. Patient is pesakit, right? So you guys are not patient, these certain people, certain person, you can still come to visit any physiotherapist outside, okay? We can assess you guys.
Yeah, I think so. The most important point here is to find a professional, which is a professional instructor, if you want to start to go to the gym and build some muscles. Yeah, okay, let's move on to the next question. So the next question is swimming or water therapy good for elderly?
Yeah, this is very good also. Okay, it is very considered as a mild and gentle exercises to be done too. Okay, but you have to make sure you don't drown yourself lah in a pool. Okay, so because swimming is a hydrotherapy, is a resistance exercise, like how you do exercise with any resistance like dumbbell or any resistance band. Okay, hydrotherapy is one type of exercise to strengthen up the muscle also. Okay, so this one also I encourage you guys to have a proper instructor, okay, professional instructor of it, okay, to ensure you guys safe to do the exercise in the water. Okay, because sometimes if you guys are not being in the water for too long time already, then suddenly you guys know that, okay, do the hydrotherapy is really good for get our movement good. Okay, so then suddenly after 50 years later, you just go inside the water, so we can become anxious and nervous. Okay, then it will lead to our safety problem also. Okay, so you guys must have a really good instructor, okay, to do this.
Thank you, Mr. Amin, for the answer. And I think we have one of our participants here, Mrs. Tay. She has a burning question, and she asked our permission to let her to speak. Yeah, please unmute yourself, Mrs. Tay.
Hi, Mrs. Tay.
Thank you. I'm Mrs. Tay from Penang. Okay, I'm one of the voluntary helper from Young Buddhist also. Okay. I've started doing voluntary work since the 80s. And then I'm now 72 years old. And in 2019, January, I suffer stroke, which leads to my left side paralyzed for a while. And and then my son put me, I'm from Penang. My son put me in a rehab center in Penang. And then we have this exercise every morning for 1 hour, group exercise. I was doing well. And then within 2 weeks, I'm able to walk with tongkat.
Okay, that's very good.
The therapist. And then the therapist is the boss of the center. And after 3 days, the boss of the center saw that I walk very steadily. He said, okay, from tomorrow onwards, you walk without the tongkat. So after that, I was walking without the tongkat all around in the center. And then everything was going on so well. I stayed in the rehab center for 1 year. And then my son worked in Singapore. After that, he came out and saw my condition was improving quite well and took me over to Singapore. I'm now in Singapore.
Mrs. Tay, I think there's been some issue with your mic. We can only hear you intermittently.
Is it? Oh, something wrong. Oh, wait. I recheck.
Yeah. Now we can hear you, but now not.
You can hear me? You can hear me well? Okay.
Yeah, I can hear you.
Then everything was going well until this July 26th. I got up at night 3:30 a.m. to the toilet, and then in the kitchen I fell, and then my left femoris bone was broken, fracture, and then my son later sent me to the hospital, but I have some complication. When I was admitted, they saw blood clot in my lungs, you know, in the Singapore hospital, and then so they say this is very dangerous. I may suffer a stroke, you see, and it's fatal. So they quickly do a procedure on me within the same day of admission. And then the whole process took about 4 hours. Everything was going on well, you know, and then the doctor was very happy after the procedure and told me that, oh, at least luckily we saved back your life, luckily, you know. But then they found that my left femoris bone was fractured, so they advised surgery. So the surgery was done on the 1st of September. You know, everything was going on well, and every day we have physio sessions twice a day. So everything was going on well, and then my recovery progressed very fast and well. The surgery part also heals off very nicely. Even the surgeon also come and take pictures, say very well, you know. So
Mrs. Tay, I'm sorry to interrupt. Thanks for sharing your story. But is there any question that you want to direct to Mr.
one
Amin?
important question.
Yeah.
But due to the COVID case, the COVID situation was getting serious in Singapore. So the hospital that I stay is a semi-government hospital. So we were asked to go home. So to allow the COVID patient to walk in, you see. So now before I was discharged, I can walk with the U-walker to and fro for 144 meters. So the therapist also say that I was doing well, but on the 14th of October, since the discharge until now, I've been lying on the bed. I'm still on wheelchair now. Cannot walk. I dare not walk. It's not that I cannot walk. I dare not walk without the therapist guidance. So I'm thinking, lama-lama kalau I tak jalan, boleh saya jalan lagi ya ke laut? That's my question. Most important.
Okay, I'm really glad to hear that you have recovering very well, Mrs. Tay. From such a condition that you're having, very good. You can see that you're a very determined person to recover, right? Okay, so now the thing is you're afraid to walk around by yourself, is it?
Yeah. Okay. Even with the help of the tongkat also, I dare not. Even so I know that I can walk. I'm okay. My legs are very strong. I'm okay. But I dare not.
So you need to continue.
This is a confidence.
Yeah, confidence. So confidence is you must get help from family members. Okay. So to share with you, or maybe that you can just get back to the therapist that you have dealing with before. Maybe can share you some exercise prescriptions, exercise paper to you, give to you, and share. Maybe if let's say the therapist can just brief you from the video or anything else. So just brief you together with your family members.
Encik Amin, that the cost of having this therapy in Singapore is very, very expensive. Especially I'm a Malaysian. I'm now on visa, you see, temporary visa. So the cost is really killing, which I cannot afford. So now, but before discharge, the therapist taught me a few exercises which I did on the bed every day. And I've been repeating it every day, many times. You know, I'm quite worried that
Okay,
my muscles will become,
definitely.
Mrs.
Mrs. Tay, you can still continue, but you must get a person to assist you. Don't worry, you won't the person to assist you, okay? The one that really strong person to assist you.
I've been lying on the bed since 14 October until now.
Mrs. Tay,
I can still walk. Yeah, doctor.
I think like what Amin say, I think it seems like it's more like a confidence issue. So I think we believe with the right help and then with regular persistent exercise, you should be able to slowly regain your mobility.
You see, but now
is that right, Mr. Amin? Is that what?
Yes, correct. Yeah, that's true.
And I'm really grateful that you share your story, but I might need to stop you here so that we can answer the questions of other participants as well. And if there's further issues and questions, and then maybe just drop us a message later on, and then we'll try to see how we can help. Is that okay?
Okay. Thank you very much.
Thank you very much.
Thank you.
Thank you. I mean, thank you, doctor.
Right. Thank you for the sharing. So now we shall move on to the next question. So the next question would be how to preserve our back or spine for those who have slipped disc or bulging many years ago.
Okay, so there are several exercises. Okay, so there are several special exercises for the backache. The back pain, especially because for back pain we have different kind of conditions. Some have slip disc, some have thinning of the disc. Okay, and some have another issue with the spine. Okay, so there is several or special exercises for that. So if you guys, so the only professional like physiotherapists, we know how to deal with it. Okay, we can guide and we will need to assess you guys. So strengthening exercise is important. Okay, stretching also is very important, and also posture. Keep your posture always in a good manner so that you won't get the things or slip disc getting worsened. So if you guys want to know the stretching or the strengthening exercise, the appropriate one, you guys have to seek a physiotherapist. Okay, so that then it will guide you and give you the exercises for you guys for your condition.
All right, thank you. So since we are talking about the posture, there are some questions about the posture as well. So some of our participants ask, what is a good posture and what are the exercises that can improve our posture?
Okay, so just sit straight, think straight, just sit straight. Okay, if you feel yourself like slouch, just sit straight. Okay, and try to sit at the backrest chair. So when you sit at the backrest chair, stick your buttock to the chair and then just sit up. Okay, so sometimes it may not, even though like myself, if I do my work on the computer or maybe I do my work, sometimes after 30 minutes later I'm slouching already. So you have to remind yourself every 10 minutes time. Okay, when you're watching on TV, when you are eating especially, okay, when you are doing any activities, so just mind your posture. Okay, even though you are already in a kyphotic posture, but it can become worsen by just straight. Just think straight. When you think straight, your body will be straight for yourself. And also to prevent it, the one that I show you, the spine. Okay, so the exercises, remember the one that shoulder, lift up the shoulder up like that, right? In the body straight. Okay, so this exercise helps to improve and maintain your posture. That's all.
Yeah, so thank you for the tips, Mr. Amin. So now we have our next question. What is your advice for people who were COVID-19 positive? How long will get back the momentum? Previously active with lots of walking as per before COVID-19. Already close to 5 months now, but find breathing panting when walking too fast. Yeah.
Okay, that is normal. There is normal reaction for COVID survivors. All right, even though you have recovered from COVID, but there is complication we call as long COVID. So long COVID means like you already recovered 5 months ago, but still after 5 to 6 months, you still have the complication, meaning that you have panting when you do exercises or maybe when you do activities. You may feel like you cannot go up the staircase properly. You feel your muscle become very weak. Okay, so you have to do the exercises that I just mentioned just now. It helps to recover back slowly. Okay, don't you worry, everyone who are having a post-COVID, they'll be having the complication of long COVID. Okay, so we can prevent it, we can recover it, not prevent, we can recover it by doing breathing exercises. Okay, just do a lot of breathing exercises because COVID is attack our lung. All right, so once the lung attacked from the COVID, because our lung become very constrict, become very tight. Okay, so we have to stretch the lungs, stretch the rib cage. Okay, move your shoulder. Okay, move your legs. All right, then it helps to improve your lung expansion. Then it will help to improve your oxygenation and helps to recover your panting issue, to prevent a panting issue. Just do walking. Okay, no need to feel. And some more thing, mental is very important. Most of the COVID, mental illness is there. Okay, they have depression. Okay, so you have to think positive always and try to find another ways how to make yourself, your mental feel better. Okay, mental feel good, because once your mental are good, then your whole body will become so much better.
Okay, so thank you for the reassurance, Mr. Amin. So now we have questions about the physiotherapy service. So actually we have two questions. The first one is more general, which is from our participant as well. So the question is, how would we get the physiotherapy service in a hospital? And another one is a more specific one, is could you please introduce more about the gym in the ReGen hospital? How do we make appointment? Like, can we walk in? Yeah. Could you please explain about that? Thank you.
So I'm going to introduce about a place that I work at ReGen Rehab Hospital. Okay, so for those who are inquire, or maybe you want to get physiotherapy treatment, or maybe you had physiotherapy treatment outside and you feel to have another physio treatment to another place, for example, like our hospital here. Okay, so usually we do really need a referral letter from the doctor outside, okay, or maybe get a referral letter, have to consult with our rehab physician doctor at ReGen Hospital, okay. Our rehab physician doctor will assess you and then will giving you a referral to physiotherapy, okay, if really need a physiotherapy treatment, okay, or it may be because the physiotherapy treatment, it can be different stages for those who really need the extreme, the advanced level type, or maybe the beginner type, intermediate. Okay, so the doctor will decide on that, and then the doctor will refer to us, the physiotherapist, and we receive the letter, and then on the same day, okay, then we will assess you fully. Okay, so for example, in our place, once for the first comers, okay, the first visit patient, we will assess for 1 hour. The treatment is, the session is 1 hour, include of assessment, include of treatment, and also some home access program. Okay, so this will include in 1 hour. So our basis follow-up is also 1 hour, 1 hour, and our session is one-to-one. Okay, so meaning that the therapist will always be with you in 1 hour time to guide you and to be with you while doing the exercise, or maybe doing the physiotherapy session with you guys. And we will set the goals, okay, during the assessment, and then prior to the goals that we know that how long that a patient, or maybe one of you can recover within such term of the duration of goals.
Okay. So how about group exercise? If can the client request for group exercise? Yeah, is the service available?
Yeah, we do having a group exercises. Okay, so usually that we do early morning. So for example, our time basis of treatment is at 9 o'clock. Okay, we started at 9 o'clock of a first appointment. Okay, so if let's say that is a particular patients that really giving a good effect, a good good recovery with group exercises, so we will allocate these patients in a specific timing that we preferred, or that you preferred, maybe for example at 10 o'clock. So we will allocate this patient at 10 o'clock, and we will do the group exercises treatment also.
Okay, so thank you, Mr. Amin, for explaining about the service for us. So we have the last few questions here. So we have this question here. How about those who are already immobile? What type of exercises will be good?
Okay, so when we talk about immobile, immobile is a general term. So immobile can be you guys can move actually, but they tend to be the one to move. Okay, another immobile type is we call bedridden. Okay, maybe it's a bedridden where the patient or the person just stay on the bed, cannot move anything. All right. For those bedridden patients, okay, so the person cannot do by himself. So the caregiver or the family members have to move the joints, each of the joint for the person there, for the person who is bedridden. With all the joints, do stretching exercises, okay, do the movement for the joints, then it helps to maintain the muscle from become very tight and to maintain the joint from become very stiffness. And for those who are the type like actually can move, just like just want to become immobile. Okay, so just now like one of my slide, you can just do the exercise in sitting position. Just sit down, okay, and do the shoulder movement, do the elbow movement, do the hand movement, hip movement, knee, ankle. Okay, in fact, you can just stand a little bit, okay, stand and then do the exercises. Just the exercise can be done only at one place only. Not only have to go to the park, go to the outside the yard. Okay, maybe it just can be done in a living room. It can be done in the side of the bed. It can be done in the dining table. Anywhere it can be done. There's no restriction of the exercises. That's all.
Okay, so we have very last question here. What is the best exercise to relieve foot pain?
Okay, to relieve foot pain, talk about foot pain is also a general term. Okay, when you talk about foot pain, sometimes it's ankle pain. Due to what? I'm not too sure. Maybe like arthritis or maybe some pulling tendons. Okay, so if it is like pulling tendons, do ankle stretching. Okay, because once the person having a foot pain, so there is a muscle tightness over the calf muscle together with the ankle. So just do ankle stretching. You guys can just look in at Google, just type ankle stretching. You guys can follow this ankle stretching. You can do in a sitting position, even though in lying down position. So you guys can do it. But if foot pain due to some traumatized injury, maybe like knock on the wall, or maybe like you just suddenly slipped and jatuh, right, and fall. So there's a traumatized injury. So it have to be checked also if it is like having a swelling or maybe having a bruises. So the pain management is have to do some icing first. Do some icing, reduce the pain, lower the inflammatory changes there, and then we'll do the exercise after that.
So that's a very clear explanation from Mr. Amin. Thank you very much. So we will end our Q&A session here, and I'll pass back to Dr. Lee. Thank you.
All right.
Right. Thank you very much, everyone, for staying with us, and thank you very much, Mr. Amin, and also to
You're
Melissa.
welcome.
Yeah. So if we haven't answered all your questions, or you have questions about what we said before, so don't worry, because like I said in the beginning, all our presentation and recording will be available in recorded form and also in electronic book in 1 to 2 weeks' time on our MNCC website. So feel free to check them out and share it with your friends and family, as all our materials are free of charge. You just need to register, and then you can log on free to look at those previous teaching material. And for those who are interested in following our future MNCC talks and the online Rehab Health Talk series, please kindly click like and follow our MNCC Facebook page. We will frequently update the dates of the future talks on the website. And also I've shared a Google form on the chat box. If you are not a Facebook fan, then just feel free to fill in the Google form to register your interest for our upcoming event. And also, please, can I ask for your kindness in scanning this QR code to help to fill in a feedback form to let us know how we can help to improve our talks in the future. And your feedback means a lot to us. So apologies again for the late start, but thank you very much for staying with us, and hope to see you all again. Thank you.
Okay, thank you, everyone. All right, for having me. Okay, bye-bye.
Bye.
Yeah. Thank you so much.
Okay.
Have a great day.
Okay, you too. Thank you.